Hi, I'm Dr. Art Hister, and this is your medical pipeline. Today it's about prostate cancer. In one of the previous medical pipelines, I talked about benign prostate disease and prostate infections. I want to spend one segment here talking about prostate cancer because it's such an important cancer for men. Now, I'll bet that most men out there listening to this, or watching this, know that 1 in 9 women will get breast cancer during their lifetimes. But how many men know that 1 in 6 men will develop prostate cancer? I mean, that's true. 1 in 6 men, 16% of men are going to develop prostate cancer. 10% of cancer deaths in men are due to prostate cancer. So this is a cancer that you really want to prevent. And, happily, we have some good strategies to prevent it. Now, there are some risk factors for prostate cancer that are not modifiable. You can't prevent those. But you can, if you know about those risk factors, you can be much more vigilant about picking up prostate cancer at an early stage, and that can help you live longer as well. Those non-modifiable risk factors basically revolve around genetics. If you have a strong family history of prostate cancer, if there's several guys, if there's 1 or more men actually in the family who've had prostate cancer, you're at higher risk yourself. The more close relatives of yours, male close relatives who've had prostate cancer in your family, the higher your risk. Interestingly, it's also seems to be true that if a lot of women in the family have had ovarian and breast cancer, there seems to be some crossover, and the men are somewhat at higher risk of prostate cancer as well. As I said, that's a non-modifiable risk factor. It's too late to change your genetic profile. It's too late to change your parents. What you can do something about, however, are what we call the modifiable risk factors. And we know that prostate cancer is significantly higher in men who are obese. If you watch your weight, you lower your risk. We know that men who do regular exercise tend to have a significantly lower risk of prostate cancer. And we also know, happily, that there are certain dietary factors that seem to protect against prostate cancer. Eating a diet really rich in fruits and veggies, particularly the cruciferous vegetables, those are things like broccoli and cauliflower, seems to protect against prostate cancer, as does eating a diet rich in lycopene. Lycopene is one of those things that's gotten a lot of publicity because it's present in very significant amount in cooked tomatoes. So people are always making fun of the fact that if you eat a lot of pizza, you lower your risk of prostate cancer, but there's actually some truth in that. If you eat a lot of tomato sauce, it seems to be that you have a lower risk of prostate cancer. On the other hand, a diet that's rich in saturated fats and rich particularly in barbecued meats also seems to increase the risk of prostate cancer. So hey, there's something you can do about that. If you live a healthy lifestyle, you can significantly lower your risk of prostate cancer, and that's good news.